Capture billing, medical billing done right. Billing a well woman exam to Medicare. Codes G0101 and Q0091. As we are all aware, Medicare still does not allow an annual well exam, as most routine preventative services are still not covered, but now allows for the annual wellness visit, AWV, code G0438, or subsequent AWV G0439. How does either annual exam or AWV relate to an annual well woman exam? They don't. An annual well woman exam is a completely separate evaluation and management service from an AWV and just a component of the routine annual exam. So how does a provider bill out for an annual well woman exam for a patient covered by Medicare? Let's discuss the components of the routine annual exam first. What does an annual exam include? Preventive medicine services, codes 99381 through 99387 and 99391 through 99397 are defined by CPT as an evaluation or reevaluation and management of an individual, including an age and gender appropriate history, examination, counseling, anticipatory guidance, risk factor reduction interventions, and the ordering of laboratory diagnostic procedures. The purpose of an annual exam includes screening for disease, assessment risk of future medical problems, promoting of a healthy lifestyle, and to update vaccinations. Aspects of an annual exam may include all or some of the following: review of history, checking vital signs, general appearance, heart exam, lung exam, head and neck exam, abdominal exam, neurological exam, dermatological exam, extremities exam, males, testicular and prostate exams, females, breast and pelvic exams, counseling, routine laboratory tests, immunizations. Does an annual exam also include a well woman exam? Yes. The annual exam also includes the components of a well woman exam. If a patient is seen by her primary care physician, PCP, for an annual, the provider will also include a pelvic exam, breast exam, and a pap smear collection. If the patient elects to have the well woman exam performed by her gynecologist, the PCP must document that the pelvic and breast exams and pap smear collection were deferred and will be performed by a gynecologist. Incorrect billing procedures. What if you run out of time? If the patient is seen for an annual and the well woman exam portions are not done during the same visit, the provider may need to see the patient again in order to complete the comprehensive exam. The second visit is merely a continuation and is not billable. Do not bill an additional E&M code, such as a 99213, as that would be billing for the same service twice. Can you bill an annual with a V72.31 annual gynecological exam diagnosis and get paid separately? No. If you have already billed out an annual in a given year, routine annual exam V70.0, then you cannot charge for another annual with a different diagnosis. What if the patient did not want the well woman exam portions done during the regular annual? If the patient did not want the pelvic, breast exam, and pap smear collection done during the routine physical, but later decides not to see a gynecologist and comes back for these screenings, you still cannot bill for these separately. They are already included in the annual. The patient may be seen, but it cannot be billed. Requirements of coding and billing an annual well woman exam to Medicare. Medicare does not cover preventative services, such as an annual exam, but certain well woman exam screenings are reimbursed either every 2 years or annually. Covered services. Medicare covers the following screening exams in conjunction with a well woman exam: G0101, cervical or vaginal cancer screening, pelvic and clinic breast examination. G0101 is reimbursed by Medicare every 2 years, unless the patient is considered high risk, and then it is allowed on an annual basis. According to the CMS website, the ICD-9 CM codes billable with the G0101 are V76.2, special screenings for malignant neoplasms cervix, V76.47, special screening for malignant neoplasms vaginal, V76.49, special screening for malignant neoplasms other sites, V15.89, other specified personal history presenting hazards to health, and V72.31, routine gynecological exam, code Q0091, screening Papanicolaou smear, obtaining, preparing, and conveyance of cervical or vaginal smear to laboratory. Q0091 is reimbursed by Medicare every 2 years, unless the patient is considered high risk, and then it is allowed on an annual basis. Per the CMS website, the ICD-9 CM codes billable with the Q0091 are V76.2, V76.47, V76.49, V15.89, and V72.31. Select the appropriate codes. Code 82270, fecal occult blood test. 82270 can be billed on an annual basis. Per the CMS website, the appropriate code varies by carrier. An applicable code is V76.51, special screening for malignant neoplasms : high risk factors and frequency. High risk factors determine whether or not a patient may have the G0101 and Q0091 on an annual basis. If a patient is considered high risk, then these screening tests may be done annually. According to the CMS website, the following factors are listed as high-risk factors for screening pap smears and pelvic exams. Cervical high-risk factors: early onset of sexual activity, under 16 years of age, multiple sexual partners, 5 or more in a lifetime, history of a sexual transmitted disease, including HIV infection, fewer than 3 negative pap smears within the previous 7 years. Vaginal cancer high-risk factors, DES, diethylstilbestrol, exposed daughters of women who took DES during pregnancy. Personal history of health hazards. If a patient has a specified personal history presenting hazards to health, then apply the V15.89 diagnosis and the appropriate health history hazard. Example, V10.3, history of breast malignancy. Any V15.89 diagnosis is considered high risk and also eligible for the yearly G0101 and Q0091. Advanced Beneficiary Notices, ABNs. An ABN is a Medicare waiver of liability that providers are required to give a Medicare patient for services provided that may not be covered or considered medically necessary. ABNs do not apply to services that are specifically excluded from Medicare coverage, such as an annual exam. A completed and signed ABN is key for reimbursement. It also notifies Medicare that the patient acknowledges that certain procedures were provided and that the patient will be responsible for full payment if Medicare denies payment for a specific procedure or treatment. If there is no signed ABN, then you cannot bill the patient and it must be written off, denied by Medicare. Translation: free services, lost revenue. ABN criteria. The ABN must be given to the patient prior to any provided services or procedures. Patient's name, specific service, and estimated charge amount must be listed on the ABN. ABN cannot be given to a patient who is under duress or requires emergency treatment. Check for specific criteria and download the form at the link below. Appropriate Medicare modifiers. Certain modifiers are required when billing with an ABN. GA modifier, waiver of liability statement issued as required by payer policy. This modifier indicates that an ABN is on file and allows the provider to bill the patient if not covered by Medicare. GX modifier, notice of liability issued, voluntary under payer policy. Report this modifier only to indicate that a voluntary ABN was issued for services that are not covered. GY modifier, notice of liability not issued, not required under payer policy. This modifier is used to obtain a denial on a non-covered service. Use this modifier to notify Medicare that you know this service is excluded. GZ modifier. Item or service expected to be denied as not reasonable and necessary. When an ABN may be required but was not obtained, this modifier should be applied. Carve-out billing for a well woman exam. Since specific well woman screening components of an annual are covered by Medicare, these are billed out separately. These screenings are carved out from the provider's usual fee for preventative service, since they are allowable and reimbursable by Medicare. The remainder balance for the preventative service is the patient's financial responsibility and is not covered by Medicare. The total fee does not change, only how it is billed and who pays. The G0101 and the Q0091 are the services that are reimbursed and carved out of the regular annual fee. The Medicare reimbursement for the G and Q and patient portion equal the same annual fee that a non-Medicare patient would be charged. For example, if the fee for an annual for a non-Medicare patient is $235, this is the breakdown for a Medicare patient. It is the same total fee of $235, but billed out differently. In this scenario, the patient will be billed for $142.35, and Medicare billed $41.96 and $50.69 for the two procedures they cover. Check with your local Medicare carrier to obtain current fees. Here is an example of a claim. For additional clarification, please refer to www.acog.org/departments/coding/Medicare Screening Services.pdf. The CMS website has a quick reference guide for Medicare Preventive Services, which lists applicable tests, diagnoses, and frequencies. Contact your local Medicare carrier for the up-to-date information.